We are in Module 3 of the CHS training for Quality and Accountability focal points, looking at what you need to know on each commitment of the CHS in order to support your organization's implementation of these commitments. In this presentation, we are going to look at Commitment 8. Commitment 8 of the Core Humanitarian Standard states that communities and people affected by crisis receive the assistance they require from competent and well-managed staff and volunteers. The quality criterion is staff are supported to do their job effectively and are treated fairly and equitably. Competent and well-managed staff are necessary to fulfill each commitment of the CHS and are essential for an accountable and effective organization. Staff need to be equipped with the right skills and behaviors, and the key issue is how organizations can support individuals to make this happen. An organization's capacity to recruit, train, and manage staff and volunteers is at the heart of adherence to the CHS. Staff-related costs are a large portion of an organization's budget, and investments in staff need to be carefully nurtured if they are to yield the best outcomes for communities affected by crisis. This is why responsibilities to staff and the organization's approach to its workforce are included in the other 8 commitments. Some of the key actions for Commitment 8 are accompanied by a PACAH requirement to fulfill the indicator. Indicator 8.1 Staff work according to the mandate and values of the organization and to agreed objectives and performance standards. There is a prevention of sexual exploitation and abuse and harassment requirement to fulfill this indicator. Recruitment, screening, and staff performance processes need to promote safeguarding from SCAH. The verification framework questions include recruitment and screening processes for personnel and consultants that promote safeguarding from SCAH, participation in the interagency misconduct data sharing program, whether staff performance appraisals include adherence to the code of conduct, completion of associated trainings, and commitment to PACAH. Human resources policy and employment contracts need to clearly outline disciplinary action and termination provisions for staff misconduct, including SCAH. Indicator 8.2. Staff adhere to the policies that are relevant to them and understand the consequences of not adhering to them. The prevention of sexual exploitation and abuse and harassment requirement to fulfill this indicator is that staff adhere to PACAH policies, including mandatory obligation to report, understanding the consequences of not adhering to them. Again, for verification, this will be examined through the means by which all staff at different levels and in different locations receive induction and refresher training on PACAH policies and reporting obligations and the consequences of not adhering to them. Staff contracts must also include reference to sanctions for failing to adhere to PACAH policies and the code of conduct. Indicator 8.3. Staff develop and use the necessary personal, technical, and management competencies to fulfill their role and understand how the organization can support them to do this. The types of action that demonstrate whether your staff are meeting the key action indicators of Commitment 8 include job descriptions, performance appraisals, induction and training schedules, materials, budgets, implementation, rollout plan for new policies, signed contracts and code of conduct, personal development plans, records of disciplinary actions, partnership agreements, partner training records, partner capacity assessment and development plans, and budgets. Does your HR practice include these processes to ensure staff are supported to do their job effectively? If not, there might be examples on this slide that become part of your CHS implementation or improvement plan? Take a moment to write them down. Indicator 8.4 states that the organization has the management and staff capacity and capability to deliver its programs. This includes processes for staff plans and can be impacted by high staff turnover. Indicator 8.5 states that staff policies and procedures are fair, transparent, non-discriminatory, and compliant with local employment law. Indicator 8.6 states that job descriptions, work objectives, and feedback processes are in place so that staff have a clear understanding of what is required of them. Indicator 8.7, a code of conduct is in place that establishes at a minimum the obligation of staff not to exploit, abuse, or otherwise discriminate against people. The PACAH requirement for Indicator 8.7 is that the code of conduct includes the obligation of staff and associated individuals and entities not to sexually exploit, abuse, or harass people and to comply with reporting obligations. To verify this, there also needs to be mechanisms to ensure staff understand, sign, and comply with the code of conduct. Indicator 8.8. Policies are in place to support staff to improve their skills and competencies. Indicator 8.9. Policies are in place for the security and the well-being of staff. The PACAH requirement specifies is that there are policies in place for the safeguarding of staff to protect them from sexual exploitation, abuse and harassment, and retaliation, including a whistleblower protection policy. The verification framework looks for a staff safety policy that addresses the risk of SCAH to staff, as well as documented processes for the investigation of sexual exploitation, abuse, and harassment against staff. Safety assessments for staff working in difficult contexts must also include the assessment of SCAH risk. Staff capacity reports, staff training plans and reports, gap analysis of key positions, analysis of exit interviews and rosters, staff handbook, staff performance policy and procedures, staff grievance and disciplinary policy and procedures, job descriptions, personal development plans, appraisals, code of conduct, contracts, induction plans, staff development and training policies and budget, security management and risk assessment, health and safety policies, care provided to staff, and of course, plans on how partners will meet these commitments, such as partner memorandum of understandings and agreements, capacity assessment, and plans. Does your organization have all of these in place? If not, there might be examples on this slide that become part of your CHS improvement plan. Fulfilling the requirements of Commitment 8 relies on organization-wide adherence to human resource policies and processes. Contextualization happens when an organization works across countries where labor laws and staff entitlements might vary. However, good practice in the humanitarian sector is to ensure staff are treated equitably regardless of their location. It is important that in your role of quality and accountability focal point, you consider the training and support provided to staff on following the policies, procedures, and guidance identified under organizational responsibilities. Commitment 8 of the CHS refers to how organizations recruit, induct, train, and manage their staff. It's about human resources, and without staff and volunteers, an organization would not be able to fulfill the requirements of the 9 commitments of the CHS. There is a strong link across all of the CHS commitments to an organization's human resources policies and processes. HR is responsible for ensuring staff are aware of relevant policies from the point of induction and through trainings in order that, as mentioned at indicator 8.2, staff can adhere to the policies that are relevant to them and understand the consequences of not adhering to them. Mainstreaming Commitment 8. How Commitment 8 and Commitment 1 link is about staff understanding procedures and technical requirements regarding needs assessment. Staff also need to understand organizational quality and accountability commitments and how these translate into needs assessments. Commitment 8 links to Commitment 2 in terms of having enough of the right staff to meet the commitments of the organization. It is about workforce planning, budgets for staff development, and emergency rosters. Having an organizational code of conduct is a requirement of both Commitments 3 and 8, as is making sure staff, volunteers, partners, and contractors know what it means and what the consequences of breaching it are. The HR department of an organization has a significant role in making sure the code of conduct is in place and staff know about it and follow it. Mainstreaming Commitment 8 with Commitment 4 is about staff need to have the capacity as well as guidance and support to share information and meaningfully engage with the affected communities and people. Information sharing and community engagement require sufficient staff time and budget. Mainstreaming Commitment 8 with Commitment 5. Training must also cover complaint and grievance mechanisms to ensure that staff understand their role in facilitating and managing feedback and complaints and in reporting breaches of the code of conduct themselves. There must be HR policies that protect whistleblowers. The organization should also plan for investigators either internally trained or externally contracted, should there be the need. Mainstreaming Commitment 8 with Commitment 6. In order to engage into coordination relationships with authorities and partners, staff need to understand how to work according to the mandates and values of the organization and to agreed objectives and performance standards, particularly in the development, maintenance, and management of key relationships. Commitment 7 is about learning and improving at the organization level, and an organization is made up of its people, its staff. Commitment 8 expects that staff that are supported to learn and improve. Policies need to be in place to support learning, and staff need support to develop and use their competencies. Commitment 9 can only be achieved if staff follow policies, guidelines, manuals, and protocols, for example, for decisions about expenditure. Commitment 9 also requires organizations to have systems in place to prevent, detect, and address corruption, fraud, and misuse of resources. There is one sector-level initiative that seeks to standardize the skills and performance expectations of humanitarians. The core Humanitarian Competency Framework lists 6 essential competency domains that humanitarian workers should acquire to perform in their jobs and make a significant contribution to assisting people affected by humanitarian crisis. The core Humanitarian Competency Framework is a collaborative joint-funded project by the START Network, DFID-funded Talent Development Project, the Collaboration Center for Recognition of Humanitarian Skills, Experience in Learning, and the CHS Alliance, and more information is available on the CHS Alliance website. Under commitment, communities are asked one question. Are you satisfied with the way aid workers providing services behave toward members of your community? This could be quality of the relationship, the languages used, the attitude and respect of your culture and beliefs and values. This has been an overview of Commitment 8 of the CHS, what might be called the cornerstone of the core humanitarian standard. Throughout this session and the module, we have linked the role of the human resources team in enabling quality and accountability in humanitarian responses through the systems, policies, and processes that are embedded in recruitment, induction, training, and performance monitoring and organization's staff. Strong organizational performance of an organization's human resources team ensures competent and well-managed staff and volunteers.